My name is John Seibert. I am the Chief of General Otolaryngology here at Vanderbilt. I went to undergrad at Vanderbilt, and then I went to medical school at University of Arkansas. And then in 2009, I joined the faculty.
My name's Daniel Schuster. I trained in medical school at UAB. I'm from Birmingham, Alabama originally. Joined the faculty after finishing residency. So I've been in practice about 4 years.
When I joined the faculty in 2009, one of my goals was to have residents training in general otolaryngology. It is a chance for them to sort of experience what it's like to be a general otolaryngologist. And unfortunately, in residency, a lot of times you don't have that exposure. A lot of times you have specialty, sort of specific training.
We're fortunate enough now to actually have a resident rotation, and so it's built into the program. And when they rotate with us, they get an opportunity to see what it's like, both in clinic and the OR, to sort of bounce around between the subspecialties. You know, in training, you're very siloed. Oh, today I'm doing head and neck cancer clinic, and it's easy to sort of get in the mindset of a type or a category of pathology.
One of the things we would do would be simulation. And simulation is one of the hot topics in residency now, especially in otolaryngology. We're trying to give them real sort of exposure to certain things before they actually have to experience it in real life. The simulation allows us to sort of give them experience without sort of the stress. And it's actually funny, I don't know if many people have done simulation before, but sometimes when you're doing it, you actually do feel that stress that's there. And that's what we want to do. We want to give them a safe environment to have exposure to those things before they have to do it in clinic. So it's a nice trial run.
Like what we do, general ENT is sort of a new thing in academics. It used to be that academics was all subspecialized because people could get general ENT care in the community. And so, you know, now you'll see places that are excited about the fact that they have an academic generalist. Well, you know, we have 3 or 4 of those, and it's the same thing in every division or subspecialty of our department.
Also, we have Dr. Tim Trone, who's actually one of our other general otolaryngologists, and he is subspecialized in smell and taste disorders. So residents don't have good exposure to that in residency, and so they get a chance to kind of work with him and kind of get his sort of advice on how to treat some of those patients. So, you know, the opportunity to be in a small community and have residents come down to that and have that exposure, I think, is what makes us unique. I've been in now 3 different academic programs, and I would say by far we have the best sort of broad or a depth and a broadness in sort of general ENT that I've seen.